Hi, Dr. Rathner. Yeah, I saw your so-called rant on YouTube. Enjoyed it very much, and it's not a rant, it's a refutation of all the nonsense that's going on about healthcare. Yeah, enjoyed it immensely. The reason I'm calling is I too have uploaded some stuff about healthcare on YouTube. I used the name Lapius because that was a counterpart I used for dialogue in a book I wrote about 30 years ago called One Man's Medicine. Yeah, maybe you can find it in the library. However, the best part of the book, I thought, in retrospect, is the introduction where I say that in the future you're going to find the medical profession conducted by paper doctors treating paper. And yeah, isn't that true? But I'd like to call your attention to a website I created about a system of medicine that I've recently devised, which I think would be a good compromise between what we should have and what the Congress is trying to do. And mainly, and the website is www.the-public-option.com. And briefly, the concept is to separate primary care from the HMOs, or not necessarily separated, but to create a primary care system that's public, that's optional, and that would enable people to contract for catastrophic or hospital care medicine under major medical contracts, short-term major medical contracts, and then have primary care always available in these centers that are scattered all over the country. There are quite a number of them now, and the Primary Care Centers of America, sponsored by HRSA, the Health Resources Services Administration under HHS, they have 8,000 of these centers now. Yeah, a lot of people have never heard of them. It's interesting to me. They're staffed by a primary care physician, pediatrician, internist, gynecologist, and dentist, and they offer comprehensive primary care. If there were enough of these, every $1 billion creates another 300 of these centers. And they're open to the public, and the fee, they're entrepreneurial. They charge fees that range from $0 to whatever a person is able to pay. And so my concept is that if we created enough of these throughout the country, primary care would be available to everybody in the country. Every American citizen would be able to go there for primary care. They could still maintain their HMO contracts, but if their doctor were out of town and they had some kind of a minor problem they considered an emergency, they could go to them. And let the high-tech medicine, which is quite uniform and I think expertly performed generally in America, let that remain in the HMO system, in private medicine. So we'd have two systems side by side. Yeah. No, we leave high-tech medicine, imaging, laboratory, surgery, let that stay private, and create this public primary care system. If you're interested, check out the website and get back to me. I think this private and public side by side has a lot to offer, and it would assure everybody in the country who's a citizen the availability of primary care, decongest emergency rooms, and lower the costs of health care for people under 40 years old, because most of them only need primary care. So they could easily get some short-term major medical coverage that over a number of years, the cost of that would naturally increase. And when they got to be older and well established, they could buy policies from HMOs. All of this would be voluntary. You got the idea? Okay. Oh, okay. Look, take a look at it. Get back to me. I really would appreciate that. And thanks very much for your time. Right. Okay. I'll talk to you again. Thanks a lot. Bye-bye.